Taylor, let's go to you for a moment and just sort of give a high level overview of why these questions are coming up now. We're going to dig into the evidence a little bit more in that pro con debate, but what's sort of changing? I think that Anna highlighted we have these newer interventions, the reperfusion considerations that is probably coming into play. But what else is sort of driving these questions?
Yeah, absolutely. I think now we are seeing that, like, now that we've had so much of this like gray area, we're starting to raise more of these questions. Like, okay, well, what about our patients with more of a preserved ejection fraction, or our patients that don't fit our typical like reduced ejection fraction criteria for heart failure, and patients that maybe we look at stopping beta blockers after a year or different durations because the guidelines don't speak to duration specifically.
Mm-hmm.
So since we don't have clear answers for some of these questions, there's been a lot more data like looking at these areas in particular. And so we've had new trials within the last like a year or so that have looked at patients with more preserved ejection fractions to see what kind of benefits or not that we found from those trials. And that's kind of what's sparking this question. But also, as we've seen the changes in like reperfusion techniques and the medications that we have available in general, we're starting to kind of reframe that question of like, what are the things that we need to prioritize? And are beta blockers one of
Right.
those things, or maybe are they not? And
Mm-hmm.
then like when we look at the comparison between like our like reduced ejection fraction heart failure patients, the pathophys there is something that is kind of, undisputable for the like chronic reduction in the sympathetic nervous system and things that with the cardiac remodeling, we've seen the data for that we can't really have that conversation per se, and there's not a role there
Mm-hmm.
because we know that there
Mm-hmm.
is. But that is so much more of an acute picture for our like MI patients, and in that acute setting, that maybe things are different from pathophys standpoint as well, where we're seeing a difference in benefits from our beta blocker use.